Ladies and gentlemen, we did not know quite how many people to expect at this meeting. Well, and there seems to be a great deal of confusion about what we are here to discuss with you and try to provide information to you. It may be of some help to discuss very briefly and very shortly what this meeting is not going to be about and what we're not here to talk about, what we're not here to do. Is to do anything other than provide some additional information about some 9 changes that we're contemplating making in the health care plan effective in July. So there'll be a lot of time and information forthcoming. But this really, the number of people that we have apparently misinformed about the purpose of what we're doing here to provide additional information has drawn so many people that we're advised by the fire marshal that we've got too many people in the room. Right, they are in the process of trying to set up a simulcast for the municipal courtroom downstairs so that some of you can go and watch on the simulcast downstairs. But they say it's going to take us a few minutes just to get that done. So would those of you who are in the aisles that got here a little bit later, make your way, please, down to the municipal court, which is downstairs. You can either take the elevator, which is right outside, or there's some stairs here. You can go down there, and I understand, Chief, do you want people out of the aisleways primarily? Do you want to make an announcement? If so, use that microphone right over there. Please, ma'am.
Thank you, Mr. Mayor. Good evening, everyone. And it is unfortunate that they said they know he's going to have all these people. However, you cannot block all that's right there. That's blocked. If you would actually move over a part that see for me at least part and leave me a pathway. Same thing back here. I'll maintain what we got for now because we got enough firemen. Yeah, we'll get you out of here. What do we got to do? The house never. That right there, I really need it clear. This area is my biggest problem.
They say it'll take. Well, they say it's going to take about 10 minutes to get this simulcast set up downstairs in the municipal court. But
ladies, y'all got to get out of the steps. You can't sit up. I'm sorry, Mr. Mayor. I'm so sorry. Do not sit in the stairs, please, for me. But I need you to clear that. I need to have a clear path, baby, to look straight through there. Not looking at all the bodies. Just clear that for me if you would. And this one looks good. Thank y'all very much over here for your participation and your cooperation. So, yes, sir.
Yeah. So number one, as we're kind of trying to wait and move people some downstairs that really want to stay and watch and wait, we're trying to make those accommodations. Let me say this, however, and if I could get your attention so that people can hear.
Those of you that's outside talking, the mayor cannot finish his sentence because you're talking too loud.
It's them that can't hear.
Yes, sir. Y'all try to get them quiet so we can move forward and I can get all these people out of this room for me.
Yeah.
Thank you.
So what happened at committee meetings this last Tuesday was the Operations and Finance Committee, after consultation with BB&T, who is our advisor for health care plan, and Matthew Arrington with Terminus Financial Advisors, voted to make 9 changes to the health care plan to be effective in July. There was a lot of debate and discussion not only at the retreat about how we can go about curbing cost and trying to provide effective health care insurance for our employees and retirees into the future and how to keep the plan solvent. there was a lot of conversation, and these recommended changes will help both of us. Currently, we're trying to pay 75% of the health care cost. We are self-insured, and we are asking you, our employees and retirees, to pay 25%. The recent adjustment that we did was to try to bring the 75-25 split of health care cost back into alignment. It had gone, because premiums had been static and cost had been increasing, it was approaching 80-20.
And I was trying to let you finish, but it was my honor to call this meeting, and that is not the way that we intended for the meeting to proceed. I would like at this time, if you would please do your greetings, and then we'll have greetings from the commissioners, and then we can proceed with the agenda as we've stated. And I don't mean any disrespect at all, but we're going through information that it's not time for that yet. So if you would please allow me to go by the agenda that I sent earlier today. Could we do that, please?
Commissioner Lucas, I am doing the best I can to preside over a meeting that I did not call.
Well, let me preside over the
No,
meeting
ma'am.
that I called.
Ladies and gentlemen, this is going to be difficult for all of us, okay? But we must maintain order and decorum as we go through this informational process. Like I said, this isn't even a formal meeting of the Macon-Bibb County Commission. This is an informational meeting that, as Commissioner Lucas said, she requested, and we are trying to comply with her request and have made. So let me then just say this. There is a prayer on the agenda, and so I'll call on Commissioner Schlesinger to give us an opening prayer.
Thank you, sir. Let us pray. Our God and Creator, this evening we gratefully acknowledge that you are the Lord our God, the God of all people and the God of all of our generations. So we take a moment to thank you, to sing your praises for our lives, which are in your hands, for our souls, which are ever in your keeping, for the signs of your presence that we encounter every day, for the many opportunities that you have given all of us to serve the citizens of Macon-Bibb County, and for all of your blessings at all times, morning, noon, and night. We pray that peace and goodwill will obtain among the inhabitants of our county, our state, our land, and that belief in you will continue to spread its many blessings among us, exalting us all in righteousness. Amen.
Amen. I've been.
Good evening. It is so nice to see a room full of taxpayers and employees of Macon-Bibb County here at your government building. This is your government building, and sometimes we forget. At this time, I'd like to call on Mayor Rickard for a brief greeting.
Hello. I'm glad you're here.
We have Commissioners Watkins, Shepherd, Allen, Jones, Lucas, Schlesinger, and Bechtel, who are here. If each of you would greet our constituents, please. We'll start over here.
Good evening. Thank each one of you for being here today. As we have this conversation about health care, please pay attention to what we're discussing as this impacts your livelihood. We're here today because we realize that these are serious implications, and we just recently made some adjustments to your plan, and we want to make sure that you're aware of the type of things that we're discussing and receive your full feedback on these items. And some of these items are worth paying attention to because the conversations about your dosage, your co-pays are very serious to your family members as well as you, particularly the retirees. And we understand the budget crunch of the county is serious, and we're trying to address it, but being proportional in the way that we do it and not impacting those that do this work every day in a way that you can no longer sustain. Okay. So we're here for information. Please be patient. I know that emotions are high. None of us are trying to be evil and do anything intentionally wrong or hurtful, but this is a lot of information for us to dissect as we learn about health care, and we are truly looking for information. So, thank you.
Commissioner Shepherd.
In a few minutes, we're going to open up the municipal court, and they'll be able to hear down there and see as well. But good Lord, some of y'all I haven't seen in years, so it is good to see y'all. I didn't have any idea we'd have this kind of a turnout, but I'm glad to see all of you. Hopefully, once our experts get up here tonight that understand these things, that they'll be able to put it in language that we all can understand and see the need for that. So once again, I'm glad to see you here tonight, and I hope they'll open up downstairs in a minute to get some of y'all a seat. Thank you.
Thank you. Commissioner Allen.
Hello, fellow retirees. I wish there was a lot more here than just you, because we need them all. Bottom line is, listen and get involved. I'm glad y'all showed up tonight, but there's a lot more out there that didn't get here. Now, we need you. We need your voice, and y'all can make the difference. Y'all are here. This is what it takes to make differences. Thank you for showing up.
I'm advised that the simulcast is set up and operational downstairs in the courtroom, municipal court.
Okay,
So
we'll
so
finish
that
the
if you go-
greetings, and then we'll make that shift. Commissioner Jones.
Don't have a mic. Okay.
Just a minute.
I hope you'll pay close attention to all the material presented to us so we can all digest it together. There's nothing more important than the employees of Macon-Bibb County. So that's why we're here. We care. We want to come up with the best program possible for you, one that's sustainable for all employees. So thanks again for coming.
Okay. Commissioner Schlesinger.
I'm just going to really echo what's already been said. I want to thank Ms. Lucas for bringing us together. We are county employees ourselves. We are affected by these same decisions that we're making today. I think we just want to be fair, and your presence here, your input is going to help us do that. So thank you all for being here, and look forward to a healthy discussion tonight.
Thank you. And Commissioner Bechtel.
Thank you, Commissioner Lucas. I want to welcome everybody here tonight. Thank you for taking time to be here, and we look forward to hearing from as many of you as time allows.
Okay, thank you. Once again, we want to say how pleased we are to see so many of you here. I hope all of you have an agenda, and I hope that everyone who wishes to speak or make a statement or ask questions, your statement will be quite limited tonight, because we don't want to, we promised this would be a 6 to 8 meeting, and we want to keep our promise. We're already a little late, but if you wish to speak tonight, if there are forms up here for you to fill out, so if you think you might want to speak, go ahead and fill out the form. At this time, we're going to pause and allow those who need to move to the municipal court downstairs. And we do have copies up here of the 9 proposed health care changes, and the I believe we have the pension, the proposed pension changes too. And even though we will not be voting on those, on the pension changes tomorrow, we are still having consultants to seek information on the impact of those. So I consider that being under consideration. So if we'll take just a minute or two, and those who wish to go to municipal court, if you would move quickly. There are no sign-up sheets.
Ladies and gentlemen, now that they have some other space for us, if you're in here and not in a seat and standing around the walls, I need you to clear out the openings for me, please.
Are we out of the? Okay. We will try to get some more copies of the healthcare options and the pension. Okay. Yeah, because she's going. We have some more sign-in sheets for those who wish to address. Just leave 'em. What? Questioning? Oh. The people still coming in, so we just gonna leave it on. All right, we're going to say one more time. If you wish to get an agenda, the agendas are up here. The sign-in sheets are up here if you wish to address the commission. Okay, I think in the interest of time, we need to move this. So let's go ahead with, who is the first person to present? Julie Moore, who's our budget officer.
I'm going to be very quick because I don't have the information you're really looking for, but I did want to provide some of the information that we've been giving commissioners in the last 2 weeks, kind of leading up to our committee meeting last week. And it's just a very brief overview of where we've been in the last 4 years. Do you have the slide? The first thing to remember is that in consolidation, we were mandated to reduce the budget. So when you look at the number in 2014, we had a budgeted expenditure for general fund of $169 million. In that same year, we actually spent $162 million of general fund. And in the last 3 and 4 years, we have been steadily trying to decrease that expenditure. And if you were here, you remember those painful conversations, and yet the ones that have allowed us to continue to work. But we had a very rich retirement plan, and we've reduced the number of people working, and that's how we've gotten the numbers down. At the same time, we were also working towards making sure that if you were in the former city, that your tax rate would be the same as everyone in the county. As everyone has the same tax rate, most recently, that is when the 3 mil increase was established last year. Next slide. I think you maybe, did you skip one? Is that it? The purpose of this is to make sure that you understand that where the money goes, the majority of the money goes to public safety, to make sure that we have fire and sheriff, EMA, and all our judicial offices funded, because we understand that to be a critical piece of the government services that we must provide. Even when we are mandated to reduce our expenditures, we have to provide those services. At the same time, we also provide some service money to outside agencies. And that's just to remind you that we have $10.7 million that walks out the door to outside agencies. Some of these are incredibly critical to getting people to work, such as transportation. And we have libraries that we support. But there are a number of others that total $10.7 million that we send out the door to outside agencies. In the room, remember that when we consolidated, we had over 2,000 employees. We now have 1,790 employees. We have really asked our department heads and our department employees to tighten their belts and to do more with less, and you can see that in the numbers because we have reduced the number of staff. And, I'm sorry, could you go back up to that one? But you also see where our salary and benefit numbers began to decrease. In 2014, when we consolidated, we really only had 6 months in that fiscal year. So when we started 2015, we knew that we were going to have to make some of these adjustments, and we had conversations about whether that would be a mandatory reduction in force. We talked about furloughs, and we finally settled on an idea of early retirement as an option. In that same year of 2015, we implemented a pay scale. 2 different entities joined together. A pay scale that was created by Middle Georgia Regional Commission and our internal Human Resources Department. Cost us about $2.5 million to implement, to put everybody on a scale. The same year, our healthcare was running okay, so we did not look to see any adjustments that needed to be made to healthcare. The following year, we provided a very, very, very small COLA, 1.5%. We did not make any additional changes to healthcare at that point. Last year in 17, we held it steady. What we didn't know was going to happen to us in calendar year 2017 was that our healthcare claims that had been $20 million, $20 million, $20 million in 2017 jumped to $25 million. That $5 million explosion of healthcare cost is what has prompted the discussion that we need to have now about how to maintain that. So in order to do that, we have enlisted a lot of people who really understand healthcare. It's a very complicated funding issue for a lot of different communities. A lot of our fellow governments, Columbus, Atlanta, Augusta, everyone's struggling with it. It's a difficult process to go through and figure out where you're going to have the best use of your money to provide for the best services for your people. So in that order, we have an outside financial advisor who's working with us, and we have a consultant strictly for our healthcare. And I'm going to ask Matthew Arrington to come up at this point and talk a little bit about some of the issues that we can address and maintain healthcare with some changes.
Thank you, Julie. Good evening, everyone. My name is Matthew Arrington. I'm the president of Terminus Municipal Advisors. I'm the county's financial advisor, like Julie said. The first thing we want to do is talk about, how did we get here? Why are we looking at health care? Why are we looking at pension? Well, we're looking at the county's overall financial, kind of portfolio. Right now, if you look on the screen, you would see that for the past 4 years, the county's fund balance, which is it's basically your savings account. It's basically what you tap into when everything's kind of, revenue doesn't come in the way you want it to, or expenses kind of go higher. Well, right now, as you can see on the screen, you guys have gone from having about 78 days worth of cash on hand down to about 19 days worth of cash on hand. There are several reasons, and we will get into that. Right now, we've done a projection with your finance director, and we said if things kind of stay the way they are right now, what will we be come June of this year? Right now, they would spend another about $3.7 million, which would take that down to about 9 or 10 days reserves, cash on hand. Next slide, Chris. One thing we want to look at is, okay, so how did you get into the situation? Well, one thing you did was you gave away, but with the elimination of city taxes, you did away with about $20 million a year in revenue. That really hurt a lot. And another thing that you did is when the counties and the city consolidated, you had about $30 million in what you call an OPEB. That stands for Other Post-Employment Benefits. That is a fund that is set up to pay for retirees' health care. That fund in 2014 was $30 million. Today, we expect that fund to be depleted at the end of December of this year. The spend on that account on retirees benefits equal about $8 million a year. So now that you no longer have that fund, that $8 million will have to come out of the general fund. So what we're trying to do is not only figure out a way how to pay for it, but we need to figure out how do we have that $8 million number not be so high. Because right now, I can tell you right now, retirees, just so people know, the benefits are the exact same for the current employees. So we want to make sure you know that. This kind of shows what goes into healthcare and pension. As you can see, like Julie said, the healthcare number was about $20 million every year, and it jumped up to about $5 million. And that is your pure claims. That's not necessarily the county going out and getting bad insurance. You're self-insured, which means that's how much in claims you did. So in one particular year, it jumped up $5 million. We need to figure out a way to kind of not only get that number down, but make sure we don't have those big jumps again. So a lot of people are saying, okay, well, what are you doing or what are you recommending that the county does just besides coming here and mess with the employees? There are things that the county is looking at right now as far as revenue and expenses. On the revenue side, some of you may or may not be familiar with, there's a bill in the Georgia State Legislature to see about letting the public vote on OLAS, which would be another 1 cent sales tax, which will allow you to receive a homestead exemption in place of it, and that will give some revenue to the county. Some other things we're looking at are increases in fines and fees, and there are several other measures that the county is looking into. On the expense side, we're looking at health care, we're looking at pension, we're looking at, potentially things like rec centers, and just everything is on the table at this point. I just want to bring that up. Obviously, if OLAS does not pass, the fix there that most governments go to, I'm not speaking for anyone on the dais, I'm just saying the next fix would be what? Taxes. So we're trying to figure out ways that we could possibly raise revenue without having to do that. There are other things that are on the table as far as expenses. So you have hiring freezes. Julie just showed you about $10.7 million that goes to outside agencies. So one thing we definitely say is, well, if you don't have the money, you can't give to outside agencies anymore. So one thing they would have to do is not give to some of those agencies, or at least cut back. Some other things is also looking at furloughs and reducing overtime. Again, one thing we want to talk about is OPEB. Again, there was once a fund set up and had $30 million into it, and it's been reduced $8 million a year. So the budget challenge that we're faced with now is when this fiscal year ends June 30th this year, you're going to have enough to cover about one or half of the next fiscal year, which means when they pass this budget in June, it has to have $4 million in it to cover retiree benefits. After that, every year, the $8 million has to come out of the general fund. So I just want to continue to say that is very important. If everyone feels it needs to stay where it is, and we want to keep the retiree benefits exactly where it is, it's going to be $8 million, and that number is going to go nowhere but up. So therefore, you have to find revenue to be able to pay that. What we're doing on the healthcare is kind of a two-pronged approach. Jimmy, who is your Henson from BB&T, is your healthcare consultant. He's going to get into specifics that you want to hear. But what we're doing is we're first of all saying, well, before we just come in and make these changes, let us look at where is Macon-Bibb in terms of, you know, Houston County, where are they compared to Warner Robins, the Macon Water Authority. So we're basically looking at the plan and said, well, one thing we need to do is we need to get this healthcare plan kind of on the same level where it is. I will be just being very blunt and being very honest. Your healthcare plan is what we would call very rich compared to some of the others. You may not think so, but I'm just letting you know. It costs you nothing to do something compared to anyone else. We have a copy of that study. We will give it to you. That is not a personal opinion. It's just a fact. So one thing we want to do is how do we do that? And, you know, I want to get one thing out there. When we say things like a plan is rich, I don't think we're saying, you know, that does not mean going from Blue Cross to another provider. It does not mean necessarily making the employees pay more. It just does not cost a lot for you to do things that it takes a lot of other people have to pay for. And we just kind of want to look about getting that in line. The second thing we would do is once we get it in line is we will go out and form a healthcare committee that's made up of government officials and employees. We want all employees to come to the table, not all employees, but we want representation at the table, and we want to basically hear from you guys, because what we have found out is the commission has been making decisions assuming they kind of know what you guys want. You know, you can have a plan where everybody kind of pays their fair share, or do you want a plan where you pay for what you use and your peers who use the healthcare a little bit more, they pay more? We don't know that. You know, what's more important to you? Is it the premium that comes out of your check every 2 weeks, or is it the deductible? We don't know that. So we want to hear back from employees, form a committee, and then we will basically bid all these things out, and based on feedback from the employees, make a plan that based on what you say you want to see. So that's kind of the plan we have on healthcare. I'll be back in a minute to talk about pension, but right now we'll bring Jimmy Henson forward, and he will talk about those healthcare changes.
Before Mr. Henson starts, I wanted to make mention of one thing that you talked about, and that is the OLOST that's pending. Our legislative delegation, and maybe the mayor knows the most current details on this, but we went to our legislative delegation and asked them to help us with, we know we've got a deficit, we know we've got problems. We didn't want to get to a point where we were proposing changes to health care and to pensions. So we thought that our legislative delegation would be assisting us in coming up with something. And from what I understand, Mr. Mayor, there are two proposals now that's being talked about in the legislature. One is where there's 100% rollback of that 1 penny to property tax owners, and then the other proposal is one that I think we all favor, where Macon-Bibb would get a half penny, and then the rollback, the other half penny, would be rolled back to property tax owners. That's the property owners. That's the one that I personally favor. I don't know about my fellow commissioners, but it certainly would help us if they would go with that particular one. Now, Representative Allen Peake is the major signer on the one to roll back all of the money, all of the 1 cent, if voters approve it. He is the one that's proposing that. So those of you who want to have an impact might want to call him and let him know that that's not going to help everybody, that the other option, which Senator Lucas is proposing and working on, is to split it. And that would give Macon-Bibb some needed funds, and it would also roll back some of it for property owners. We've got problems. We have problems. And so what we're trying to do is to get the information, let you know how bad it is, and ask you for your help with this. And the one thing that I want to say right now that I think we need to do is impact our legislators to make sure they go the right way on what they propose bringing back to us to help us. The 100%, the 1 cent going to property tax rollback, all of it won't help us. It'll help one segment of the population. Half of Macon's population rents. Then the other proposal, which is to split it, we get half, and then the other half would go to rollback. Is that the way that you understand it, Commissioner, the two proposals? I do. So before we leave tonight, we're going to ask you again. Now, I'm not going to vote for the proposal tomorrow night. I hope that the other commissioners, there are enough of us to table this for a little more study. But the other part of it is going to be to ask our legislators to do right by us and send back to us something that helps everybody. And I think that would give us some time, and we would not have to vote yes for drastic measures like we're proposing for, like the mayor is proposing for health care and your pension. So I just wanted to throw that out there since he mentioned the OLOST. So that's something for us to consider, and we can start lobbying tonight. They're at home. They don't go back until tomorrow morning. So we need to be calling those legislators and telling them we want the split. That's the proposal we want to get out of there, out of the legislature, and come back for a vote. I'm going to hush now and let Mr. Henson go ahead with his presentation.
Thank you, Commissioner Lucas, and thank you, commissioners and mayor and staff for actually, it's a great opportunity to communicate. Those of you that come to the open enrollment meetings annually down at the city auditorium have seen me up there talking, and this year when you saw me, we talked about some changes that went on with contributions, and why? Because of increased cost. And I think it will be helpful for you maybe to understand how your plan, what makes up your plan, not just the deductibles, but actually the inner workings of your plan. If you look on the slide behind me, I'm going to turn around so I can see better, and I apologize. But at the top, you'll see the administrative cost on your plan represents 4 to 5% of your total spend. So what does that mean? That means that you pay an administrator, and in this case, the administrator is Blue Cross Blue Shield. As the mayor said earlier, y'all are not fully insured, you're self-funded. So you have to pay somebody to actually pay and process your claims. One of the significant things in there, you pay them for pre-certification, subrogation, coordination of benefits, network access fees. What does that really mean? That means when we went out to bid, we had the different vendors reprice the claims from both City of Macon and Bibb County to see what the discounts would be. And 1% discount in y'all's case represents about $220,000. So 1% matters. So that's part of the process that we're going to use that Matthew mentioned earlier and Commissioner Lucas did, that what we are suggesting they consider are a couple of changes that will help impact immediately, but then we are going to be looking at probably more significant changes based on feedback that we have. But we want to educate you so you can go in and understand why some of the things are done. One of the things I wanted to mention, go back to that slide if you would. One of the things that I'd like to mention there, in addition to the claims processing, data storage, and all that, you have Live Health Online. Y'all remember what Live Health Online? Can I see a show of hands if anybody tell me what Live Health Online is? I got how many? All right, 6, 8, 10, 12 people. Guys, Live Health Online is something y'all need to be using. Keeps your costs down. It's gone to free. It costs you nothing to use Live Health Online to consult a doctor. So look at that. Those are things that are out there that'll help you and everybody else. One of the other things I want to mention to you, I talked about network access. Right now, you've got great coverage in Macon with physicians and hospitals. That's really good. Some of you will be receiving letters in the mail from Blue Cross Blue Shield. If you have received treatment at any of the Piedmont facilities in Atlanta or any of the facilities they own, they are in a network discussion with Piedmont. All right? What does that mean? That means that they have already filed to terminate Piedmont's contract effective April 1st. Now, let me tell you what that really means. It means that basically they're in negotiation. They're both playing hardball. It's all about finances. Blue Cross wants to get as low as they can on reimbursement. Piedmont wants to get as high as they can on reimbursement. And they're trying to get close together. Typically what you'll see is it goes down to the last day. This happened about 4 years ago with Navison Health and Blue Cross. Some of you may remember that, but we had already made arrangements with Navison Health to continue your coverages the same. So there are a lot of things that are going on behind the scenes you may not see, but that was to make sure you had providers. At the bottom, you'll see stop-loss insurance. What is stop-loss insurance? That means if somebody has a large claim, okay, has a claim over $300,000, City of Macon and Macon-Bibb has purchased reinsurance to help pay that claim. So the City of Macon-Bibb doesn't have to pay all of that. Those two components represent about 9% of the total $25 million spend. Okay? They really represent a little less than that. They're about $2 million. So what does that mean? Go to the next page if you would. On the next page, you'll see variable cost. Claims, 90% of the plan cost. The plans fund claim for all employees, retirees, and their dependents make up your plan 90%. So 90% of every dollar you're contributing in to the contribution is going to pay claims. Same with the Macon-Bibb. So where do you have the biggest impact on your claims, on your cost, is your claims. So what we're talking about is being a wise utilizer of your plan, but also seeing where it goes. Where do you go for treatment? Who do you see for treatment? Live Health Online. Stay out of the emergency room, if appropriate. What are they being seen for? What are you getting treatment for? All of these areas, and you can see that represents 92% of the spend. That's where your cost goes. Claims drive your cost. Okay? So what we're trying to do is help you be a better user of your plan. Next slide, please. Just as a recap real quick, you'll see in 2015, you can see the fixed cost is $1.8 million. Suggested budget number is $21 million. Your actual claims are in the yellow. It was 18.9. Total plan cost was $20,757,000. In 2016, it was actually $20,220,000. It went down. Why did it go down? Because y'all had less claims. That was a good thing. Okay. Keep in mind your contribution hadn't changed for 3 years. This is the first year that it has changed. And then in 2017, unfortunately, we saw an uptick in your claims, and the projection is that that uptick is going to stay the same. Why do we say that? Because we look at a report that gives us month-by-month claims, and it's not like 1 month had a spike. It's pretty consistent. I just got the report, the ag report for January. The claims for January is $1.6 million, which is down from the average of $2 million. But last year, the claims for January were about $1.5 million. So even January is up a little bit. Next slide. This is sort of a busy slide, but what it shows you is what all your claims are for the year in 2017. You'll see $23 million, and then you'll see $327,000. That's where the reinsurance kicked in. For people that had these really large claims, reinsurance kicked in, so it reduced the claim cost down to $22,908,000. But remember, you got your fixed cost on top of that. So that's why we're talking $25 million. Next slide, please. Again, just looking at your increase per member per month, and you can see medical paid claims. You'll see in 2017, 2016, the 11 million versus 8 million. The claims were up in 2017. Let's go to the next slide now. I'll sort of show you. This is a breakdown showing you inpatient claims. On the far right-hand side, you'll see 2015. You had 153 admissions, and they totaled $2,622,000. In 2016, you had 15 admissions. Remember, your claims were down in 2015? Well, you had fewer admissions, and it was $1.6 million. So claims were down. That was good. What happened in 2017? Claims were up. You had 192 admissions. 192 is a large number, big increase. If you look at it, you'll see claims over $75,000. You had 22 people who had claims over $75,000. And so you will see total paid $3,206,000 for just inpatient. Inpatient means they admitted to the hospital and they're staying in the hospital. Now, your outpatient emergency room visits. If you'll notice, in 2015 you had 579, 2016 663, and in 2017 749. So we're seeing higher utilization again in the emergency room. One of the things that we're concerned about is a lot of those claims, not all. We expect that you're pretty competent people can make wise decisions, but some of you have decided to use the emergency room as your doctor's office. And so what happens, we can track it by diagnostic codes. we're seeing higher utilization of the emergency room. So we want to encourage you to use the emergency room appropriately, but don't misuse it. And then you'll see down here, the average paid per emergency room visit, $1,333. Just to give you some reference point, if you went to an outpatient, it's about $222. Excuse me, not an outpatient, but a urgent care clinic. Instead of an emergency room, went to an urgent care. And by the way, if you went to Live Health, it's free. If you sign up for Live Health, it's free. All right, let's go to the next slide. All right, stop-loss claims. You can see here where the claims are, and this shows you sort of an ag, what we showed before. If you'll go to the next slide, y'all's loss ratio is at 90%. All right, January, you'll see, paid claims in 2016, you'll see inpatient, outpatient, professional are doctors and people like that. You can see your medical total was 13 million plus your pharmacy of 5 million for a total of 18,673,000 in 2016. In 2017, inpatient, you had 349 versus 306. You had 4,887 versus 4,674. And professional, you had 45,986 versus the 44,000. Bottom line is you had 55,000 prescriptions versus 52,000 in 2016. So as you can see, everywhere you get care, there was an increase in 2017. Do we like it? No, but it is what it is. And again, you're self-funded, so you're paying your claims through contributions. If you go to the next slide, paid claims by product, you can see it sort of touches on the prior slide. 2017, you'll see 17 million versus 13 million for your medical spend. The prescriptions went up, but quite frankly, not like we're seeing in our other plans. They did go up, and we're concerned that that's coming, okay? Because you have specialty medications, and y'all have heard me mention about specialty medications. Some of those are $4,000 and $5,000 a month in prescriptions. Now, if you need it, absolutely get it, but let's be prudent in how we spend our money. Think of this. This is y'all's money. It's your plan, okay? You're a member of the plan. It's your plan. Let's go to the next slide. All right, this is a slide that I think tells a lot. If you look at the left-hand side, you'll see 2017, and you'll see claims. Of the claimants, a claimant is an individual had a claim, and you add all the claims up for the year, okay? So of all those people covered, and when we say covered, you've got about 2,050 employee and retirees covered, and then with their dependents, we got about 3,800 individuals on your plan, all right? So we've got 3,800 people. Out of that number, 1,933, 2.7% of the total claimants, they made up 4.4%. So if you look down real quick, let's just go down to 5,000. Well, let's go down to 4,000 and 4,999. Basically, you've got 7, 15, 21, almost 75, almost 80% of your claims were less than $5,000. That's actually what we typically see in a plan. That's not unusual. But what we did see also was an increase. If you look at 2017, paid thresholds, all right, you had 23 claims over $100,000. In 2016, you had 10. Okay? Guys, you're using the plan, and there's some high cost in there. Now, are you glad it's there? Absolutely. That's why it's there. It's there to protect you. You remember me saying down at the City Auditorium, this plan's like the biggest team sport. Everybody pays in. Not everybody gets to score a touchdown, but everybody's paying in. Okay? Well, in this case, you can see that 6% of your 0.6% of the covered lives made up $3,800,000 of your claims. What does it tell you? Y'all have had large claims. Okay? Good news is if you know somebody or you yourself have had a large claim, that's a good thing. One of the things we saw was we've unfortunately seen an uptick in cancer claims. That's not a good thing, but that's what we've seen. We saw a higher uptick in maternity claims. We don't think you're going to stop having babies. We don't encourage that. But we do want you to be aware of the cost, so maybe you will ask. I was with a client today. They've got about 1,000 employees, and she was talking about her son went to Ortho, Georgia, and he hurt his knee, and they said, we want you to come back for an MRI to check that knee out. She goes, he's walking around pretty good. I don't think I'm going to wait another day and see. those are the kind of decisions that would be helpful for you and everybody else on the plan, is to be a wise user of your medical plan. But you can see there's an increase here. Next slide, please. So medical plan costs are challenging and increasing. Just to recap, they were $20 million in 2025, $20,617,000, I mean 16 and 17. That says projected, because at the time we made the slide, we did not have the December numbers in. The December numbers actually came in about $40,000 less than the $25,079,000. What impacts your cost? Emergency room, outpatient claims are up, prescription drug costs are up, increase in cancer patients along with their associated costs, and then maternity claims are up. Next slide, please. Y'all have got this stuff in front of you that we've talked about, all right, the recommendations. And these were really, the root of these came from Macon-Bibb and Matthew going, Jimmy, we need help on our health insurance. What can we do? So we went in, and I know these are painful, but let me explain to you. These are actually small cuts to the big plan. We're not talking about changing your deductible. We're not changing your co-insurance amount. But I can assure you, those will probably be on the table for discussion when this committee meets. Because again, we're trying to get that cost back down from $25 million to $20 million. Okay? And the number one impact on that is going to be the claims. That is the number one driver. Okay? So, with that said, if you look at it, we're talking about changing the prescription benefit plan to the essential drug list. What does that really mean? Well, that means that we're going to narrow down the drug list. Okay? Doesn't mean that you can't get medications you need. It just simply means some of you may need to change medications. Now, is that an inconvenience? Absolutely. Is it a situation where my doctor's tried 10 other medications and this is the only one that works for me? You let us know, and that will be dealt with on a case-by-case basis, okay? But generally speaking, by reducing the number of drugs you have in the plan, guess what happens? You get a deeper discount from the drug vendor. So it helps drive the cost down. Based on y'all's prior claims in 2016 and 17, this will impact about $325,000 on an annual basis. If this goes into effect July 1, you can cut the number in half. But again, these are things that we're trying to do that will cut some cost, okay? The next one talks about changing the copay amounts. And what does that really mean? That means that when you go to the doctor right now, you've got a $10 copay, changing the copays on your drugs. You got a $10 copay on your generics. They're talking about increasing it to 15, and then increasing the formulary from 30 to 55, and the non-formulary going up to 70. And right now it's at either 50 or 60, depending on your plan. That's a cost. Nobody can argue that. But by doing that and making these changes and then adding in the home delivery, what's home delivery? I'm on a maintenance medication. I got high blood pressure, or I got high cholesterol. Your medications will be mailed to your house, okay? But you can see, and the copays there are basically 2.5 times whatever that upper copay was. The savings here is $400,000. $400,000 is real money. But you know, as one of the commissioners pointed out, Jimmy, we're talking about a lot of changes, and all of them added together don't add up to but $1.3 million. That was right, but it's one brick at a time, guys. We got to just take every little thing we can, and what we're doing is trying to minimize a radical impact to y'all with the plan design change by going in, and in our business we call these tweaks. Now, if it's to your pocketbook, it's not a tweak. I fully understand that, but we're trying to look at the whole group, not each individual. So we're trying to weigh all that in. The next one you'll see, the home delivery complete. This requires maintenance medications to be filled through mail order. And again, that's a maintenance medication. Maintenance means I'm on this medication for the rest of my life. I'm going to be getting it, okay? I've got maintenance medication on my plan right now, and it's delivered to my house. I pick up the phone, I dial in, punch some buttons, I reorder my prescription, and it comes to me. You get your prescription filled once a year, you send it in, and they'll mail it to you every 90 days, and that's the copay. And how do you pay it? You can pay it with a credit card, you can pay it with your bank card, whatever, but it's a convenient factor. But it helps drop the cost down, $130,000. Implementing Tier 4 on specialty drugs. Going to this is a change. Right now, y'all got a 3-tier drug plan, but we're talking about adding specialty drugs. And basically, it's 20% of the cost to a max of $300. And you go, dadgum, $300 is a lot of money. It is, But if you think about a generic drug up here costs $15, and the average cost of a generic drug is going to be about $40, you're almost paying half of that. Sure. We expect you just to get the name brand.
Okay,
You can still get the
we'll
name
have
brand.
questions later on. We'll have questions
Thank
later on.
You'll still have access to that. This is just on maintenance medications, on the home delivery. I mean, on tier 4. Tier 4 specialty drugs, when you see Humira advertised on TV, some of those drugs, they are very effective at what they do. But the drug companies have a patent on that drug, and they get to charge what they want to charge until somebody else comes up for it. And those patents last anywhere from 5 to 7 years. Well, when they get that patent, as I mentioned earlier, $4,000 to $5,000. Some of them are $10,000. I got a client in North Carolina. They got an employee. His drug spend is $36,000 a month. Okay, very rare drug, but that's what it costs. Costs a lot of money. All these cost money, and that's what we're trying to do is figure out how to pay for them. If you go to the next slide. The next one is implementing standard edit of dose optimization. What does that really mean? It has $12,000 impact. What does it mean? My doctor's given me a pill. It's 50 milligrams. I take it 3 times a day. Okay. What if I only took it 1 time a day at 150 milligrams? Is that okay, doctor? Is it okay? Yeah, that's fine. You can do that. That's dose optimization. That saves some money, okay? We're not trying to take your medication away. We're just trying to be smarter in how it's delivered. The next one is choice tier network. This is a one that's very interesting. The retail tiered network, anchored by CVS, Target. Obviously, we don't have a Target. It includes Walmart, Kroger, Safeway, other grocery stores. What this is talking about, if you think about your copays at your doctor's office, you know how you have a $20 copay for your primary care and a $45 for your specialist. All right. What we're talking about doing here is actually having a preferred drugstore, and you see the ones that are on the list there. If you get your medication there, you have a lower copay, the one that we showed. But if you go to another drugstore, you still get your drugs. You're just going to pay a higher copay. Why are we doing that? Because we get a lower discount. This is all about trying to drive you behavior-wise to lower cost options. We're not trying to take anything away from you. We're still giving you choice. But we're going to say with choice comes a little bit of price, okay? If we were trying to give you options here. The next one is the increase the EPO, HMO copay. Right now, if you go to a primary care, it's a $20 copay to go to your HMO, or it's called really an exclusive provider organization, but the HMO. We're talking about increasing that from $20 to $25. So it's a $5 increase per interaction on a copay. Now, that cost, it impacts about 70,000. Again, all these are based on annual numbers, so if you cut them in half, effective July 1. The next one down is implement a $250 copay for outpatient surgery, and that would generate about 68,000 in savings. What does that mean? You go to the doctor's office and they say, Jimmy, you're going to have surgery, but we don't need to put you in the hospital. We're going to do it on an outpatient basis. Okay, that's fine, doc. It's cheaper to have an outpatient surgery than it's going to the hospital. But it is going to cost me, it's more than just a copay. I'm going to have a $250 copay on that. That is one of the changes we're talking about making. Again, all of these are changes that are going to cost people money. We're clear on that. But we feel like they're at least in the range of affordability as far as not putting too much of a burden on any one person. The next one is make ER copays consistent across all the plans. You may remember at renewal, we increased the emergency room copay to $200 for the HMO and $300 for the point of service plans. What we're talking about here is really just changing the HMO plan, increasing it from the $200 to the $300, just making them the same all the way across. Everybody's got a $300. And again, y'all hear my call, Live Health Online is a great thing. And just so you know, the medical center, Nympha Saunders, who's the CEO, tells me 70% of the people they see in the emergency room could be seen in another setting. They get overcrowded up there. They don't necessarily want you in there because you have a rash. So, I mean, use the emergency room smartly. We're very blessed, by the way, to have the medical facilities we have in this town, but be wise utilizers of it. The last one, the non-emergency use of the emergency room, this was a recommendation that the commissioners did not approve. okay? They chose not to approve this, but I'm just going to tell you what it is for education. It's basically, if you go to the emergency room and the coding comes out and they're saying, hey, Jimmy, you went there for a rash, you really could have gone to an outpatient facility, urgent care, or doctor's office, that's going to be an ineligible claim. We're not going to pay for it, okay? All right? So they decided they didn't want to do that. So just so you know, they looked at some options that they didn't vote to approve, trying to be sensitive. But this would have saved $118,000. And this goes back to the emergency room being utilized as a doctor's office, not being utilized as a hospital emergency room where you have a significant medical condition that needs to be treated. So we're just trying to help educate you. It's great y'all are here. I'm very appreciative of y'all coming out, because I think the more information you have, the better informed you are, the better you may understand a decision. It's like a client of mine told me years ago, my employees don't like the decision we made, but they understand why you made it. Okay, and so a lot of this is just trying to give you information. I think, what's the next slide? That's projected savings, $1.3 million if you did all of those. It does say that the pharmacy and all has to be implemented by March the 15th in order for us to put it in place for July 1. And if you are affected, if one of your prescriptions is affected, you'll actually get a letter. Go talk to your doctor. This medication is going to be treated differently under the formulary. It may have a higher copay, or it may not even be an eligible drug under that prescription benefit. But there are other drugs that you can take in lieu of those drugs. So it does require you to be active and participate in the process. And what's the next slide? I think, okay, this is really the end of the medical piece, and I'll turn it back over to Matthew, Commissioner Lucas. I'm going to turn it back over to you.
Thank you. I was trying to see whether we were going to do questions or comments first. I think probably questions first. And our time is, see what it's 7:02, so we'll do 30 minutes questions and then the other 30 comments. Does that work? And once again, we do apologize that this room is not large enough, but this is a good problem for us. We're just so happy to see all of you here this evening. All right. Oh, okay. Yeah, we do need to do the pension. All right, I was rushing ahead. We've been reminded by our interim county manager that we didn't get the pension. Hopefully this one will be shorter. I think it's much shorter, and then we will entertain questions. So y'all please be patient. This is a lot of information, but it's important that you are here to hear this information, and then we'll open it up for questions and then for comments.
Thank you, Commissioner Lucas. If we can go back to that last slide real quick, if you don't mind, one more. Again, I just wanted to reiterate on the healthcare piece. What we're also asking the Board of Commissioners, not tomorrow, but in our work session week after next, is to bring forth a healthcare committee. That will be made up of, as I said, we made a segment of all employees, and basically what we will do is take a deeper dive into these things, and we will send questionnaires out to all the employees, find out what's important to you, and then you will have representatives who come back and kind of say, let's go out and bid a plan that looks like this. We want 3 health plans, we want 5, we want 1 big one, we want to separate retirees. I mean, we don't know what it's going to look like, but we're going to have a chance to do that. So I just wanted to reiterate that. So on pension, as you guys may or may not know, you guys have 3 different pensions that you operate here. It's based on consolidation and when you may have retired. So basically there's a pension, and Ben, correct me where I'm wrong, I think there's one for old City of Macon employees. That one is what we call a closed one. We call it Division A. That will be that middle one that you see there, that's general employees pension. There's fire and police pension. That was for police and fire prior to consolidation. We're not talking about those 2 right now. So if you fall up on one of those 2, we're talking about what you call your open plan. This is for people after 2014. And that is for anybody who's hired now, and that's the one that's open, and that's kind of the one we kind of want to get a handle on. As you can see, it has the highest contribution rate right now of 6.2 million. That number has jumped around each year, so we want to look at, you know, how do we kind of control that number. So we can go to the next slide. So we were asked by the county to say, look, can you guys tell us what is the city of Atlanta, what are the other counties and communities doing for their pension? As you guys know, a lot of people are changing the way pension is being done. So we just brought forth a lot of recommendations. We asked the commission, you guys let us know which of these you want to look at. We will run studies, and then make the change. So right now, there's no change that is being done. The only thing we're asking them to approve tomorrow is permission to do the studies to see what the impact is going to be to individual employees. That way they can make a better decision. The first decision that's always on the table is to do nothing. Just keep it the way it is, and we'll see what happens. I will tell you that is the only recommendation I do not like. The reason being is if you are 50 or close to retirement age, I feel pretty confident saying I think you're fine. But what about those people who are 22, 23 who are just starting? If we stay on the same course, I think it's unlikely that pension benefits will be there for them at some point. So we need to do things for those people, going forward. All these options more than likely will have a grandfather group if the commission wants to change something. What I mean by that is if they decide, hey, we want to do employee contributions or something like that, or change something, they will more than likely have a cutoff to say people with a certain amount of years of service, we're going to keep them the way they are. And this is just for employees that have, 10 years less of service or just new employees. So, it has a lot of moving parts. So the first option is require employee contributions. So right now, if you remember on that first slide, there was about $6.2 million pension contribution. The employees right now pay none of that. The county pays all of that. That number goes down some years when you have pretty good years in the market, but mostly it goes up. It goes up for two reasons. It goes up when you don't have real good economy. Thankfully right now we do, so that number did go down a little bit this past year. But it also goes up when you guys get raises, because that's a bigger number that they have to cover. So, it's just one of those things where you may like it, you may not, but that number goes up. So what we're doing, so one option of the study that's going to be ran by your actuary is basically going to say, well, what if we got employees to pay some percentage of that? That 5% right now, what if we asked employees to pay 2.5% of that? What would that look like? So that is one option that is being looked at. The second option that's being looked at is it was voted upon by this commission that the pension gets automatic cost of living adjustments. Well, I think one thing we immediately said is, well, what if it's a very bad economic year? Is that really a good thing to do? Same thing with raises. Is that a good thing to do when things are not going well? So we're saying, can you just look at adjusting that maybe on a year-by-year basis, or let's tie it to some kind of index and say, well, when the economy is going great, it automatically happens. Because right now, regardless of what happens, that cost of living adjustment is kicked in, and it just doesn't matter, and it makes the required contribution even higher. So that's another thing we're looking at. Next slide. Another thing we're doing is to create a new tier. And basically what this is keep everything the same, and when we get new employees in, we're going to give them this plan that has different changes. It won't look like anything that you guys have. That is somewhat significant because right now the county is hiring about 100 employees a year. So what we will say is, well, keep everybody where they are, and we'll make some small adjustments that says things like they can't retire as soon as you guys can. They have to pay some money into it. You can do all kind of different things. So that is an option that the commission will be able to look at. The fifth option, and I'm sorry, but in essence of time, I probably won't do as good a job as I can, but a cash balance plan is basically what you guys kind of know as a 401k. What it is the county will continue to put money towards something, but obviously some people will like this, because what happens is you have the option at retirement. Let's say at retirement you get money put into your account every year. Well, there are a couple of good things about it. Just like a 401k, if there's a hardship, you can borrow against it. Just like a 401k, what happens is when you reach retirement age, you have two options. If you have $100,000 in that account, you could basically say, give me an annuity and let it pay me $8,500, which will be your retirement benefit. Or you can say, write me a check for $100,000. I want to give it to my kids to get married, or for me and my husband to do what we want to do. That is just a different kind of option. The good thing about the cash balance plan is it is a flat percentage. It does not matter what the market does every year. So from a county standpoint, they would have to decide, we're going to give 5 or 10% or whatever that number is every year. It goes into your account. The bad part, and I'm going to be honest with you, if the market doesn't do well, just like a 401k, the amount that's invested may go down a little bit. So if you're thinking about hitting a certain number, you know, you may hit more than you're expected to hit because the economy did well, or you may do less. So again, it has its good parts and bad parts. Real quick, next slide just talks about some of the good things about it. It is a little bit more simpler. Right now, you have certain formulas that you have to follow. You have different tiers of employees, those who were hired before 2011, after 2011, after 2014. You got years of service. Your pension is based upon your last three, you know, your last three. So, I mean, this is simpler. Okay, highest 3. Okay, I'm sorry. But this was a little bit more simpler because it's kind of easy to, you know, it's kind of like a savings account. You get money put in each year and you see the balance and you say, it's just kind of like that Social Security statement you get in the mail that says, hey, if you retire today, here's what you would get. That's what this is. Portability, again, if you don't stay here for 20, 30 years, when you leave, you can take it with you. Cost control is what I kind of talked about by the amount being kind of fixed. And flexibility, it kind of allows the county to say, hey, we want to give more money each year. Next slide. This again kind of talks about the grandfather benefit. Again, it would be our recommendation to not make any changes for those employees who have X amount of years already into the system, those who are close to retirement, because most of these things are not beneficial to people who are set to retire 5, 6, 7 years from now. So we would more than likely find a cutoff point if they were to make any changes to make sure it doesn't affect certain employees. Next slide. So what we're doing with this one, as I said, there is no recommendation on the table. The only thing that the commission is voting on tomorrow is just approval for your actuary to go out and run the studies on all these scenarios to say, here's how would it affect each employee. Here's kind of what it would look like if we did it. Here's how much would come out of that check. Here's how much money the county would save. And at that point, they would possibly make a decision. So that's all this is kind of saying right now. I think that's it. Next, is there another slide, Chris? Yep, that's it. So with that, we'll turn it back over to Commissioner Lucas for questions.
All right, thank you. I know that's a lot of information, but I think our panel has done an excellent job of providing it to you, of presenting it to you in a way that could be understood by those of us who don't understand all of that kind of stuff. And we appreciate them being available here for us. We're going to go to questions. We asked earlier those who had questions if you would provide those, and if you wanted to make comments, if you would give us your name, fill out. We still have some forms down here for anybody who's something has come up and you wish to be recognized. But we're going to do the questions first. And let me repeat to you that on tomorrow evening we do have before the full commission the recommended changes to your health care. We do have that. The pension changes, there's a what is it, $15,000 that is the fee for us to get the firm to do the study and bring back the information on the pension, the information that was just presented, the last information. But we will be considering on tomorrow evening, unless we table it or amend it or whatever on tomorrow at the commission meeting. This is the best part. Do y'all have anything else? We've been joined by Commissioner Al Tillman, who's our newly elected Mayor Pro Tem. Do you want to greet everybody very briefly? Because they're anxious to ask questions.
Yes, ma'am. I just hope we continue this, and I'd like to see HR and this commission partner to do this at least quarterly. I mean, I think we have to have the input from the employees, and I think going forward, I think that's what we need to do. And I'm going to make that recommendation to y'all at some point.
Okay, thank you. Sounds good to me. Okay, Ms. Jones, are you going, oh, do you want me to do the? All right, we have Roderick Dennis. Yeah, if you'll, unless we have a cordless, which might be a little easier. No? All right, well. And the person after Mr. Dennis is Darylyn Morris Sr., so if you'll come on.
Good evening, everybody. Excuse my attire. It's my off day, so I was comfortable. Just being a solid waste. Yes, ma'am.
Excuse me. We're going to allow, since we do have quite a few, we're going to allow, these are questions, so you should be able to do your question in a minute so that they'll get a chance to answer. So let's just do a minute on that, and then we'll do 2 on the comments.
Okay.
Does that work?
Sounds
good. Does that
good.
work for everybody? Okay.
Appreciate it. I think one of the pressing questions that we have as a department on our side is that it was mentioned that there's $2.7 million going out to outside agencies, and yet all the information that you guys are needing to collect seems to have to be provided from an outside agency. And with everything that's being slated to change as far as healthcare, that's only 1.3, 1.4, but you have 10.7 going out. So we're trying to figure out, is this something that's actually going to benefit, or is it just a situation where we're being slated for the changes, but everything up top seems to stay the same? Because a lot of the top heavy stuff that's going above our pay grade, it's like that's where most of the money's going. It's not to the people that's out here facing it every day. And I mean, if the healthcare, we're looking at things where the healthcare, or you guys are going to decide when we should take medication or what is deemed as an emergency. You know, if you're at home and I'm having chest pains, who's to tell me that my chest pains aren't a heart attack? So if the ER is where I need to go to find that out, you know, and then to say, well, if you go and it's not a heart attack, then we're not going to pay for it. That's almost like holding me hostage on my choices.
Okay, was that a question?
The question for me, I guess, is moving forward.
A question and a statement.
Yes, ma'am. The question is moving forward is these changes in healthcare actually going to make any type of an impact as far as what our overall deficit is, or is this just somewhere, let's start at the bottom first and see what happens?
Okay. Who's going to answer that? Whoever is appropriate to answer.
But now, oh yeah, there you are. First of all, let me address outside agencies, because I think a little confusion is there's a difference in a professional service, which we might do and do a professional service for us, and that's often a small amount that's contracted, kind of like Commissioner Lucas mentioned, maybe a $15,000 fee to have a specialized professional come and give us the numbers. So I'm not running the numbers, Ben isn't running the numbers. Someone who is an actuarial can look at the numbers and say, well, this is what each option would cost. So that's a little bit different. But we do spend a lot of money with outside agencies where we are providing money to museums, to the library, to certain smaller, maybe food bank, Meals on Wheels. And we have, in the last few years, offered the opportunity for many of those people to join the healthcare plan, and they pay an additional fee in order to do that. But it's helped them in a nonprofit world where it's just incredibly expensive to get healthcare. I mean, it's not just us at Macon-Bibb. Small community organizations. The school board's a little bit lucky. They got a larger plan. We've got, I think, Macon Housing Authority. Everyone is struggling with how we really pay for these increasing healthcare costs. So no, it's not just the lowest. It's not easy. It's not anything that is going to bring the greatest fruit that we need. But we brought these initial ideas up in August when BB&T came to us and said, wow, your healthcare charges are exploding. And if we had made those changes in August, we might have seen that full benefit this year. But because we haven't been able to make those changes, it is going to be a large part of our deficit that we see this year. And as Jimmy said earlier, last January, when it started tipping up and it was 1.5 million in claims, he's already telling us tonight this January was 1.6. So we're trying to play catch up with that in the sense of we can't completely gauge how often people are going to access the health care. What we are trying to do is to change some behaviors and how you access it in the best way for you, but also in a way that makes it right for everybody sitting in this room, because ultimately it's always going to be a 75-25% split at this point, unless we follow the suit of other organizations who have maybe a 70-30 split. But if we stay at 75 and you're paying 25, do you want to pay that on $20 million in claims, or do you want to pay that on $25 million in claims?
Okay, Mr. Morris, thank you.
Good evening. My name is Darrell Morris. I was watching TV last night, and I saw Mr. Allen out in West Macon. And he said that you all was broke, didn't have no money. My question is, I want you people to look at these people here. Majority of these people are struggling to pay a light bill by Friday. A lot of people had their water cut off this morning. They works for the county, the city. This is a circus. And these are not y'all monkeys. I'm looking at this board right here. I'm willing to bet I got $101 in my pocket right now. But I'm willing to bet every bit of it. Half of you hadn't even been to urgent care. You probably have your private doctors.
Mr. Morris.
I just want to ask a question.
Well,
where is the money?
get to it.
Where's the money? Last year was 8 million. This year is 12. I'm asking where's the money? That's my question.
Okay, thank you, Mr. Morris.
Can I
know
get
that
somebody
was-
to answer?
I think the initial slides said where the money, where the.
We couldn't see that slide, that little bit of slide where I was sitting at.
Mr. Morris,
Okay.
Thank
I
you.
just wanted to say thank you for the opportunity.
thank you very much. Carl Fletcher, and to be followed by Charlene Maynard. David Sherrill.
Good afternoon. I heard a rumor, and if somebody can clarify it. If we vote for a SPLOST in November, I'm assuming it's going to be on November's ballot, and the taxpayers pass that SPLOST, and it goes in effect January 1st of 2019. Will the rollback also go in effect January 1st, 2019? Because I heard a rumor that the city could wait 2 to 3 years before the rollback and get the SPLOST money and continue to get the $3 million increase for 2 to 3 years until they decide to roll it back.
Okay,
So
who's
somebody can
going
answer
to
that?
respond to that?
The legislation that's being proposed by the legislature is a local option sales tax, not a special purpose. So it's adding on a penny. Right now, the citizens of Macon-Bibb County pay 1 penny of local option sales tax. This will be making it an additional penny, 2 pennies. And what the law says is that if the citizens voted on it in November at the general election, then that tax would be implemented beginning April 1 of 2019. So we would collect it for 9 months in 2019. Thereafter, the rollback, the law specifies, the Georgia Code, that you roll back the tax in the next succeeding calendar year. So in the next succeeding calendar year, which will be 2020, we would roll back the 9 months that were collected in 2018. The next succeeding calendar year, we'd roll back the entire, by Georgia law, no choice, the entire 12 months. One thing that Commissioner Lucas talked about was there has been a request, and for some of the commissioners feel like that having the 50% rollback would be better, not being required to do the whole 100%. But right now, I think the legislation that's being proposed is actually the 100% is what's been introduced. That's why Commissioner Lucas was saying call your legislator. But it would not be any choice we'd have about when to do the rollback.
So the county will benefit at least until 2021 on the 3 mil increase until the complete rollback.
Well,
plus
I guess you could say,
penny.
if you want to look at it that way, first rollback of the extra additional penny would not, in accordance with Georgia law, not occur until 2020. So you could look at it, you could take that viewpoint that benefits 1 year of 9 months worth of taxes, if you wanted to look. But the rollback has to be for the entire amount. The reason is because in 2019, when you go to issue the tax bill, you won't have had a whole calendar year of collections of that local option sales tax to roll back. So Georgia law says you do it by the year, you do it the next year. So certainly, if you want to take that viewpoint, you could say that. But then we can only do it the way Georgia law allows us to do it. It's not a choice.
Okay. Okay. We just had time for one.
I'm sorry. Thank you.
All right. Thank you. Ms. Maynard.
My question is on the implementing the home delivery. The home delivery to me, in this day and time, with all the mail services being hacked, either picking up packages from someone home, you're at work, or you're out, or I have medication is late coming. I would not think that would be a great plan. I know we are subject to doing changes. But a home health care delivery implemented, because I have a monthly drug, seemed like to me I should have the option, if I should want to go pick up mine from the drugstore, even if I have to pay an additional $2. I don't think the implementation of home health care delivery is something that should be imposed on individuals.
Okay. Did you want anybody to respond?
I would like to know if the county will consider that as an option, because a lot of people, based on where you live, you're not going to want mail delivery. Based on I'm not here, I'm at work, I don't want home delivery. And that shit, and the way it sounds like it's going to be implemented, but those maintenance drugs, and it doesn't give those individuals under maintenance drug an option.
Thank you for your question, and you're reading that correctly, but this is why this kind of meeting's great. It's good feedback, and those kind of plans can be tweaked. If done so, it does result in a lower savings to the plan, but it is something I think the commissioners want to hear. So please understand, a lot of plans have that, and yes, the issues you've outlined are concerns, but generally speaking, it does work. However, in modifying this plan, they can modify it to allow you to not require that, and that's up to them. That's their decision. But thanks for your feedback.
Okay. David Sherrill. Denise Bryant. You think these folks might be downstairs? I'll just put them at the Calvin Palmer, who is Officer. Oh, okay.
Now, Lucas, I think they really answered my question, because I was wondering about how it's going to be broken up. So I really have a comment now. Since we all work for the city of Macon, I think the city of Macon should make sure they take care of us. We shouldn't worry about our health care, because people are going to have babies, people getting older, they're living longer, cancer is here. I think that if there's, like you gave a suggestion of other options for them to cut money, then they should look at that first before they start messing with our health care, because in order to live, we got to have health care. We got to go to the doctor, and he said that Health Live. I hate to be one of those people that just say, I don't like that, but you know the problem I had with it. When my daughter called at 3 o'clock in the morning, fever, they said, we can't give you prescription. We can't give you any antibiotics. So got to take her to the emergency room, $150. I paid $20, $150 for them to tell me they couldn't help her. So we don't use that anymore. So, I mean, and you verified I did go. They didn't give her a prescription. So I don't want to use that again. But I do have one question. When all the movies came, how much did the city of Macon get for the movies when they came here?
Okay, that's a question
That is
for
a
another
question.
day, but I understand, and I've had a similar question.
Yeah.
Thank you, officer. Do you want to? Go ahead. Rufus Holmes, we could have your attention, please. Rufus Holmes, Alex Grubbs, Rebecca Greist. Pardon?
Information we can cover,
Okay,
but because of HIPAA, I can't go into specifics. But Live Health does not treat every conceivable condition. And generally speaking, they can treat most of those. And again, I'd encourage you to use it and sign up for it. But there are exceptions to every rule. And we have talked, and she talked to me at the annual meeting, and we talked to Blue Cross about it. And there were circumstances there that allowed them not to be able to handle that particular situation. But I do not want you to think that is the case, because we can certainly introduce people who said, I have used it and it has worked. So I would say, you know, anecdotal stories don't always tell the whole truth. I'm not at all disagreeing with her comment, but I just want you to make sure you understand Live Health does in fact actually work. It did not work in her case. Thank you.
Okay, thank you. Mr. Holmes?
I had comments, not a specific question. So if you want me to go ahead with my comments, or I'll wait.
Short comments?
Yeah.
Okay.
I do want to thank you for having us here tonight so you could hear from everybody. First thing, Mr. Henson, when I think there was 9 different agencies that bid for his position, when he presented his bid to y'all, he brought up about a county clinic and a county pharmacy to save money. Never ever heard no more about that. Second, I know y'all gonna probably have to go through with some of this raises in the insurance co-pays, but the two, talking to a lot of retirees, the two they most are concerned about is the home mailing of the prescriptions and the pill optimization. That's the two things, and they're not the most cost saving. And I will bring up one other thing when you're talking about the pension plan. You say you're only talking about the Bibb County pension plan, the Macon-Bibb County pension plan, the one that's still left open. And I do not understand why the Bibb County retirees have to suffer and not receive a cost of living increase, while the other two plans that are closed continue on with automatic COLAs. We went from consolidation until last year without a cost of living adjustment. And we got it, y'all approved it into our pension plan. And it does not need to be removed. Okay. My name is Rufus Holmes. I'm a chairman of the Bibb County Retired Employees Association. And I was just answering.
Okay, thank you. Thank you very much. Alex Grubbs, to be followed by Rebecca Greist and Wade Horton. Going to respond. I'm just too quick on this. I see this handful of stuff and I'm trying to get through it.
going
Go
to
ahead.
respond to Mr. Holmes' comment about only looking at the Macon-Bibb County pension plan, and Matthew can correct me if I'm wrong, but we're going to look at that plan first, have the actuary do the studies and see from that plan, since it's our largest plan and is our most cost from a contribution standpoint. If the commissioners decide there's certain things they're just not going to consider, then we won't look at those for the other plans. If there are things that we're considering, then we'll look at those, have the actuary look at the other plans for that. But with respect to the cost of living increase, I think that is something we would look at for all three plans. We understand it's the same for all three plans now. We wouldn't just single out one. But that was actually something we were trying to do, to look at that plan first, and then from the feedback we get from the actuary and discussions with the commission, decide before we spend more money we don't have to look at the other plans. But we are aware that it's the same, and we wouldn't just single out one group.
Okay, thank you. Mr. Grubbs?
I have just a few prepared.
Officer Grubbs, excuse me.
I have just a few prepared comments very briefly. An earlier speaker stated that the commission is raising property taxes. I would suggest that this proposal amounts to a $1.3 million tax increase targeted specifically at this county's public servants. I'm not sure how this is affordable for everybody spread out across the county employees. A number of our employees make $20,000 to $30,000 annually. This is not affordable to those employees in any way. Many of the lowest incomes are already struggling financially due to health care costs. This plan punishes them by turning their hardships into financial disasters in some cases. This proposal causes many of our regular medications to be unavailable, raises prescription costs at every level, and punishes employees for an already expensive prospect, outpatient surgeries. Finally, on January 1st, your public servants began paying almost $1,000 more per year in premiums alone. We were told that increase was due to the $5 million increase in healthcare costs last year. Now, just 51 days later, you are about to vote to take even more money from our families every month. We, the people, are speaking out to say that this proposal is unacceptable on every level, and we implore you to vote no on what I have dubbed Reichert Care.
Thank you, Officer Grubbs. Rebecca Grice.
Can you hear me? And thank you so much for having this informational session. I did not have this information prior to this meeting other than this morning when I was piecing things together, so thank y'all for doing this. My employees had a lot of questions. I echo some of the same ones that especially Charlene Maynard said. You know, really there is a concern when it comes to a person who needs to pay 3 months of a prescription cost up front when they're already on a pretty limited income. They've got pretty major medical problems. I've got 2 severe diabetics in my office, and their regular maintenance medications, understand, are already huge. They're already, some of them, 2 of them are taking like 10 medications a month. They already use what they can in the mail prescriptions. One said, I do CVS because I can get it cheaper there. They give me an incentive to go to CVS, so I go there, and then if it's cheaper at Walmart, I go there too. So please understand, our employees, especially the ones who have major medical costs and have ongoing maintenance prescriptions, are working very hard to try to control those costs. Just understand that I kind of encourage y'all to look a little bit further into that, because if you live in another county and don't have a CVS close to you, don't have Kroger, Jones County doesn't have Kroger. So, I mean, there were some things that, just talking to my employees today, that really did come out that I urge y'all to consider. And another question that I had briefly is, at one point, and I've been, an employee with City County for 23 plus years. At one point, the county required retired employees who were eligible for Medicare to use Medicare as their primary insurance, and then the county paid for their Medicare supplement as the health insurance contribution. Is that still the case, or is there something different? And no, I'm not trying to get stoned by retirees. I'm just asking.
Mr. Hubbard or Mr. Dre, with your
Upon retirement, if you can stay under the health insurance until you reach age 65,
Okay.
or become Medicare eligible. Upon reaching age 65 or Medicare eligible, the county would no longer offer health insurance to you.
Okay, so it just stops.
Yes.
Okay, all right, that's my question.
Okay.
Thank y'all very much.
Thank you very much, Madam Solicitor. Wade Horton,
Say two.
to be followed by Willie Frazier and Benita Mitchell.
I'm gonna be very quick, oh, sorry. Right here, okay. I'll be very quick, cause I'll speak 5 minutes tomorrow about this. But I would just like to say, I would like to implore you guys to table this tomorrow, because this has not been given enough time for employees and retirees to digest it, to understand it, to know what question they need to ask people tonight, or here listening to stuff. But when they get home, they're gonna be like, oh, I should ask this, or I need answers to this right here. I don't know how long y'all worked on it, but this is very new to us. So I implore you to vote to table this, give it more time, and also give people enough time to come back, ask questions at another forum just like this. Because 2 minutes is not enough time for anybody to make health insurance decisions. So, and the question I would like to ask also before I leave is, open enrollment just happened. So why is this problem happening now? We read the headline in the paper saying health care to employees are going to be cut and pensions going to be cut. So people are here tonight because no one trusts what's going on in this building tonight. No one trusts this because of the timing of it. If it was a situation about trying to educate people to keep costs down, the perfect time to do that would have been November, December, before this health care. I yield my time.
Thank you, Mr. Horton. Mr. Horton is a retired deputy sheriff. Mr. Frazier.
Good afternoon. My name is Willie Frazier, and I understand a lot of the issues that I've heard tonight. And there's one thing that I want to say to the commission, in which I say a lot of things to the commission at different times, and even to the people of the city of Macon. All of these employees and all the ones that deal with health care and stuff like that and having a hard time with health care, I implore you, commission, and people of Macon to see about those people. The retirees, see about them, because guess what? They retired working for the city, for this city. They retired working for this government, and they deserve to be healthy. And the reason why I say that is because if you look at it now, the ones that retired, they gave their all to make everything what it is and make the city government work. And the next thing with that is the ones that still working for the city. And I appreciate you as well. And the reason being, and the reason why I say so, is because those people, if they're sick, then the city shuts down. If they're going through, it'll shut this whole city down if they're not healthy. So if they have to go to the doctor, have to go to anything to see about themselves, to take care of themselves, you take care of them and you see about them, because you need this city to keep going. You need this city to keep working. And you need the people to keep working. And I implore each and every one of you, even you as commissioners and stuff like that, find a way, look into some things, that come up with some money in other areas. I come in here every week, from week to week, and I see money being squandered in different ways on things that can wait. But these things right here in these city people cannot wait. Thank you for your time.
Thank you, Mr. Fraser. Benita Mitchell, to be followed by Ben I can't, Bariloff, Bacon, pardon? Yeah, I guess it's Barfield, to be followed by Consuela Jackson. If you'll come on up. Ms. Mitchell.
Commissioners, retirees, employees, I urge you to read and read between the line. When a physician calls your house and tells you that your insurance company has dropped your plan and you may owe thousands of dollars from 2016 and 17, you need to be aware and concerned because it should not have happened. We had open enrollment. We were informed. We were told that things were going to be okay. And guess what, people? They changed my plan. Right out from under me, they took my family plan and they dropped my husband's care, who's older than I am. My son was embarrassed at the dental office when he realized he didn't have coverage anymore. And what I need to do is upgrade my plan. When I was told it would automatically roll over because everything is already done. You don't need to change a thing. I urge you, commissioners, get real. I urge you, retirees, speak up. Don't let the factors in the White House trickle down on our governments. Just, stay in it, you all. Stay in it. Don't fall down. Don't bow down. Just stay in it and just recognize we're not stupid. We're just not stupid, people. We are educated. Some of us took back seat to our education to serve this government. So take your education and use it. Use it wisely. And it's a hard decision to make. I had a former coworker tell me he put his house up to sale. He thought he was going to be able to sell his house. Now he can't. And it's putting him back in a trailer. Get real. Have some mercy on us because, like he said, our health care is important. But seniors, you all fuel this city while other people are coming in and making money off of this city. You still fuel the city. You give us the gas money, you give us the electricity, you give us everything, and you're putting it in this economy. So you can't backbite us. We're not going to let you. You just can't do it. Thank you.
Mr. Barfield and then Ms. Jackson.
It's a pleasure to be here. Well, I'm going to talk about, y'all talking about the police and fire pension, how it's going, not stable, but 1984, the mayor at the time took out where firefighters, policemen were paying their share, and the sucker at the meeting at the auditorium said, we're going to give you a pay raise. How can the city government at the time give a pay raise to the firefighters of their own money? Just think what that pension would be from 1984 to the present time if the police and firemen had paid into it. And at one time, the city brought up about reinstituting it, and a lot of firefighters, like myself, were willing to pay it. But the commissioner needs to listen to the employees and retirees. And like the lady before me said, they made this city all their sweat and blood. I don't really do this very often because I'm not a good speaker. But I appreciate your time, and you too, Mr. Allen and Mr. Bechtel. Adios.
Thank you. We like that camo too. Ms. Jackson.
Good evening. I just had a question. Each one of us pays to the 911 fund from our cell phone bills. Where do those funds go? The budget doesn't specify how those funds are allocated, so I just want to know where those funds went. And also, the police and the sheriff and firefighters got a raise for being, I guess, public safety. What is the E911 classification? If we're not public safety, how are we classified? We're essential personnel also.
Okay. Anybody want to do that quickly? Mm-hmm.
Speaking of cell phones, can you hear me now? We do collect the money that comes in from cell phones, and it actually goes into a special revenue fund. So it's separate. Here's the general fund, here's a special revenue fund. So those funds go into account for the salaries that are paid into E911. However, we have not been receiving the revenue throughout the years, and we are one of many people throughout the state who have gone to seek an attorney's assistance in helping why the revenue continues to decrease from these cell phones, because we know everybody is using cell phones, and so we're looking at that revenue. So when the E911 fund doesn't have enough of that revenue, then we have to put money from the general fund into the E911 special revenue fund. But to your other point of public safety, it's a great question. I think if everybody up here had the ability to create money, they would want to give everyone who touches any part of public safety a raise. As the gentleman said earlier, that there have been some increases, and for public safety, the biggest increases have been in the last 4 years. When you had the pay scale, a COLA, and the most recent increase for fire and sheriff only, some of those have been on average maybe an $8,000 increase in a salary in those 4 years, because it has been the feeling that public safety of the people on the front line was critically important. Is that completely fair to general employees or people who have some sort of interaction with public safety, such as E911 or a civil court sheriff or a ranger or a no? And if we could write the money, we would do it today. But we have to balance it with the revenue that's coming in and the expenditures that are going out. And so we have to recognize that where there have been increases for fire and sheriff above and beyond what other general employees have had, we have not had the revenue to do it for everyone. And that doesn't make anybody happy.
Yeah. Okay, thank you. David Sherrill, see, and Keith Williams.
Is it on? Okay.
Yeah, I think so.
Okay. My name is Keith Williams. I have one comment and 2 questions.
Okay, fast.
Okay. Before we consolidated, the citizens of Macon-Bibb was told when we consolidated, there would be no more taxes, property taxes raised. All of a sudden, the school raised their, city come right behind them and did it. The mayor got on TV and turned around and said, if the splosh is not passed, he was going to have to take $12 million out of the budget. Well, what you need it for? If you didn't need it, don't put it in there. Now, if we don't pass the splosh in the November election, he's going to have to raise the property taxes. Like the lady said, we better read between the lines. And I've been standing back there for a while watching every one of y'all. It's only every last one of y'all was sitting here very concerned to me. That guy over there, the last one, he was doing something. The mayor stood up there like he really wasn't concerned. We voted y'all in.
Okay.
We voted y'all in, and y'all better listen to what we're saying, because this is not right. Thank you.
Hey. I know that's one of my constituents. I just looked at the address. Did Mr. Sherrill come in? David Sherrill or Cheryl? Cheryl. Okay, have we overlooked anyone? Last call, because our time's about up. We'll take the gentleman over here, and that will be it. You can come to the mic.
I can't come to the mic trying to get to everybody right now.
Oh, okay.
I can speak up loud enough, though. My question is in reference to the healthcare piece. If the formulary changes and the dosage changes, who and what type of credentialed person is looking at and making the decision affecting the safety for the patient for the increased dosage at one time?
Just to answer your question, that's part of what you pay when you're paying an administrator, such as Blue Cross or any other administrator, and also what's known as a pharmacy benefit manager, known as a PBM. Those are trained and licensed both physicians and pharmacists that have come up with the formularies to put these plans forward. And obviously there's liability on the carrier's part if they're not appropriately handled. So they're very keen on making sure that you have options and that those dosage are appropriate. And some of you may have been through what's known as step therapy. Step therapy is where I was on a medication and we changed plans, for example, and they made me go back and take a lower dosage of a plan and just to see if it'd work. And the reason for that is a lot of times you have new medications that come on the market that can replace existing medications. So you're paying part of that administrative fee is to pay the professionals to make sure that you're taking the right medications and not putting you at risk. Now, does that mean every single drug you want's covered? No, that's why you have a formulary, and that's why they're trying to save it. But there are medications available on the formulary for every condition that is out there.
Okay, we've come to the end of our agenda. We have tried to provide as much information. We want to recognize Sheriff David Davis. We're glad to have you here. Are there other elected officials who are here? I know Rebecca Greist was here. Who else? Lester Miller with the Bibb school system. Anybody else? Okay, we appreciate having you here. We hope that you've gained some information. I know you know more than you knew when you came in. We have learned more because even though we've seen this a couple of times, I've learned some new things about it. And we want to thank our presenters, some from out of town who came to provide this information and answer your questions. We really do appreciate all of them. If you will give all of our presenters a hand, please. And you do have, all of your commissioners were here. Mr. Bivens' wife is ill, and I'm sure that is why he is not here. But you have to know that we are concerned. Now, the question becomes, will the commissioners take into account the concerns that you have expressed? And it's left up to you at this point to make sure that you reconnect with the members of the commission and the mayor, who is a member of the commission as well, although he won't be voting on tomorrow evening on this health care issue. It's left up to you to make your feelings known to the commissioners who do have a vote on the health care proposal. That is the one that's before us, that will be on our agenda tomorrow evening. The pension will not, but there will be a request for consultant fees to get more information on the pension modifications. So the only thing that I can say is that I am concerned about this. I'm concerned about you. That is why we called this meeting, so that we could get your opinion. Are there other commissioners or mayor? Do you have any final comments? Anybody? Okay, it is 8 o'clock. We kept our promise. Thank you so much, and we'll see you tomorrow evening at 6.